A 52-year-old male patient known case of hypertension was presented to us in emergency with altered sensorium, severe headache, and bilateral vision loss from 2 days. Whenever you see a patient with bilateral vision loss, the causes must be posterior circulation, stroke, retinal detachment, mostly unilateral, and methanol poisoning, vertebral or basilar artery stenosis. So upon taking history of this patient, we came to know that he is methanol and ethanol addicted. So this case was diagnosed as a case of methanol poisoning. This methanol, which is called industrial spirit, is going to convert into formaldehyde, and this formaldehyde is going to convert into formic acid. Formic acid is toxic and produce acidosis, metabolic acidosis, retinal damage with blindness or vision loss, basal ganglia damage, and hyperosmolarity. So the lethal dose of it is 30 ml to 50 ml, 0.5 ml per kg. As little as 10 ml is enough to cause blindness. On ABGs, there was high A9 gap metabolic acidosis. On MRI brain, there was hyperintensity bilateral lentiform nucleus. Now basal ganglia is consisting of, this is caudate nucleus, this is putamen, this is globus pallidus, this is thalamus, this is subthalamus, and this is substantia nigra. The putamen and globus pallidus together are called lentiform nucleus. Now we have to remember that basal ganglia is metabolically, it is the most active station part of the brain. So any metabolic derangement like hypoxia, hypoglycemia, etc. will affect the basal ganglia. Now for the causes of bilateral basal ganglia hyperintensities on MRIs are Wilson disease, Huntington disease, and metabolic encephalopathy, hypoglycemia, hypoxia, methanol poisoning, and carbon monoxide poisoning. This is the MRI of methanol poisoning case. Pause the video and find where do you see abnormalities. So there is bilateral symmetrical hyperintensities in lentiform nucleus or capsuloganglionic bleed with lentiform nucleus involvement. Now these pictures are just for learning so that you can appreciate the exact location of these nucleus or basal ganglia on CT scan or MRI.